Welcome everyone, and thank you for attending this webinar with Fullscript and Dr. Ian Hoffman. My name is Sarah. I'm part of the marketing team at Fullscript, and we are very excited to have Dr. Hoffman with us today to discuss how to turn supplement plans into student loan forgiveness. Before we get into the presentation, I wanted to go through a few housekeeping items first. So just a reminder that this recording will be sent to everyone who registered. So if you have to leave early or just want to watch it again, you will have access directly from your inbox. The recording will also live on Fullscript's website, where you can access all of our past and upcoming webinars as well. And with that, and at the end of the webinar, we will also save some time to go over any questions that you have. So please make sure to add them in the chat during the presentation. And with that being said, I'm going to pass it over to Dr. Hoffman to take it away, and I'll rejoin you closer to the end for the live Q&A.
All right, thank you so much. I'm going to pull up the presentation here. There we go. All right, hi everyone, I'm Dr. Ian Hoffman. Really grateful and excited to be here with you and share this with you all today. The title of this presentation is Turning Supplement Sales into Student Loan Forgiveness, and I'm going to show you exactly how to make that happen. There have been some massive changes in the world of student loans over the past few years, and I know that student loans can be crazy confusing. I talk really fast and there's a lot of information to cover, so there will be an opportunity for Q&A at the end, and I have some free gifts for you, but there's really, really important details here that will absolutely save you a ton of money. So let's jump right in. First, I want to mention, I'm not trying to sell anything on this web class. My purpose here is to just expose more people to a strategy that could end the student loan anxiety for good, and potentially save you hundreds of thousands of dollars. This webinar is being recorded live, so there will be an opportunity for Q&A at the end. If you have questions as we go, like she said, please put them in the notes or jot them down. I also want to give you some free bonus gifts. So when you go to www.erasemystudentloans.com/Fullscript, I'm going to ask for your name and email, then you'll be taken to a page with 3 links. One of those links will get you into my calendar, so you can schedule a free student loan strategy call with me. The next link will give you a link to go back and watch this web class if you're not able to stay to the end, or if you want to rewatch some of the material. And the last link, Fullscript was kind enough to give a free Fullscript account for everybody in attendance today, so you can use that to register for your free account. For those of you who have never seen one of my presentations before, I'm going to take just a quick moment to share my background, and then we'll jump right into the content. So I'm a chiropractor. I took out massive student loans to pay for my education. This is me at graduation with my parents in 2010 from Life West. And at that time, I was over $150,000 in debt, which is crazy. Chiropractors today are graduating with closer to $250,000 in debt. So it's going out of control. But when I first started repaying my loans, my payment on the standard 10-year plan was over $1,700 a month. And I paid that for a while because I was lucky enough to have some savings, and I just didn't know any better. I wanted to pay off my debt as fast as I could. And so I remember doing the math, and over 10 years, I was going to repay $204,000, which is $54,000 of interest. That's crazy, right? But I got off relatively easy, and I didn't even borrow as much as I could. This is kind of a funny slide, but I did the math and saw how fast student loan debt is increasing. And I know this is shocking, but if costs continue the way that they have been over the past 10 years, when my son, who's 9 years old at the time of this picture, when he's ready for chiropractic school, if he chooses that as a career, he would need over $400,000 to pay for his education plus room and board. And the crazy thing is, today, some dentists and naturopathic doctors are already graduating with that much debt and more. So also, I want to say you don't need to be a doctor to utilize these strategies that I'll be teaching today. Any healthcare provider can do this. So back up a little bit. In 2013, I was 3 years into practice. I tried to qualify for my first mortgage, and I was told that my income was okay, but the debt to income ratio was way off because of the student loans. And, you know, I just needed to figure this out. I just didn't want student loans to ever hold me back. My son's mom was pregnant at the time, and it was just a really stressful time in my life. So I started doing some homework. I switched to an income-driven repayment plan, which significantly lowered my monthly payments, and that allowed me to qualify for the mortgage. That was the good news. The bad news was a few months passed and I started to realize my debt was actually going back up. It was growing because my payment was less than the interest. But since now I was paying my mortgage and had a son and who was weeks old, I couldn't afford to switch back to the 10-year plan. And that meant I was stuck. I was frustrated, confused. Honestly, I was angry with the student loan system and constantly worried about finances. So I figured out that my balance was growing because I was stuck in this black hole of student debt that so many people find themselves in this exact same situation. The income-driven repayment plans have you make 20 to 25 years of payments. If your payment is less than interest, your balance will never go down. And most people have no clue to expect a huge tax bill, in some cases, which could be for over $100,000. So what I'm going to share with you today, in 2014, I figured out a way to qualify for the fastest and only tax-free form of student loan forgiveness. In 2016, I launched a program called the Student Loan Eraser, which has now helped over 600 healthcare professionals, healthcare providers qualify for the same program, saving an expected $150 million combined. It's still crazy when I say that out loud. I love that number, but this is actually my favorite slide of the whole presentation. This is the letter one of my clients got December of just last year, December 2023, showing she got $283,940.87 of her student loan debt erased. You can see the amount forgiven, principal and interest in that box at the bottom, and her outstanding balance was taken to zero. So just take a quick moment and check in with your body right now. Think about what it would mean for you and your family, for your mental health, for your quality of life to get that kind of debt erased, right? Well, let's jump right in because I'm really excited to show you how. So first, this is a disclaimer. This is my lawyer. He's not really a lawyer. He just plays one on the TV show Suits. But this web class is for educational purposes. There's obviously no guarantee you will qualify for student loan forgiveness by watching this presentation. But that being said, I really believe that knowledge is power, right? And I've done my absolute best to use this last several years of my experience to create the most clear and accurate presentation on student loan forgiveness that's ever been presented. And I really wanted to give this as my gift for you guys. So it's my sincere hope that this web class helps empower you. And I know this information has the power to really change your life if you take action on it. Okay, so here's, let's jump right into some of the most recent changes and how it impacts you. And then we'll talk about student loan forgiveness and how to use supplement sales to actually get your student loans erased. So on June 30th of last year, the Supreme Court voted 6-3 against President Biden's promise to erase $10,000 to $20,000 of student loan debt for everyone. And while $20,000 of debt forgiveness would have helped millions of Americans significantly reduce or eliminate their debt, for most healthcare providers and doctors that I work with, this would only have been a small drop in an ocean of debt anyway. So the good news is that there are still two types of student loan forgiveness programs that any healthcare provider can qualify for. One of them happens in the income-driven repayment plans that we talked about. The other is a federal program called Public Service Loan Forgiveness. So also that same day on June 30th, the Biden administration released a new income-driven repayment plan. It's called SAVE, S-A-V-E. And this income-driven plan will cut borrowers' monthly payments in half. It'll allow many people to make a $0 monthly payment and save everyone else at least $1,000 per year and ensure borrowers don't see their balances grow at all from interest. So we'll explain more about that in just a bit. So first, let's talk about the income-driven repayment plan forgiveness. All of the income-driven repayment plans have you make 20 to 25 years of payments based on a fraction of your income, and then any remaining debt is forgiven. But this is really important. A lot of people don't know this, and the servicers have not been great at explaining this to people. When your debt is forgiven, it will be taxed as if you earned the income that year. So imagine having an extra $150, $200, $250,000 of debt that was forgiven, but now you have to claim that as income on your taxes. Most people have no idea, and that could be a six-figure tax bill. So that's really scary, and it's really important for you to know that as a detail. They're calling it the student loan tax bomb. So a student loan tax bomb occurs when your student loan lender forgives all or a portion of your debt, causing you to include this amount in your taxable income, right? Really important. So the other type of student loan forgiveness that we'll talk about today is called public service loan forgiveness. PSLF is the only tax-free form of student loan forgiveness. It is also the fastest, and there are only 3 requirements to qualify. So one of those requirements is that you need to be enrolled in an income-driven repayment plan, and that means you'll have the lowest payment, but your debt gets erased 15 years faster and tax-free. So I did something really unique, which helped me reverse engineer one of the other major requirements for PSLF. I'm going to show you exactly what that was in a little bit. But first, let's compare the IDR forgiveness with PSLF in more detail. So on the left here, most of you are on an income-driven repayment plan already. Most of the companies out there offering to help borrowers qualify for student loan forgiveness, really all they do is get you enrolled in an income-driven repayment plan, which you can do for free through studentaid.gov. A low payment and then debt forgiveness sounds like a pretty good deal, but here's the catch. Most people are stuck in this black hole where they qualify for a payment that's less than the interest, which means their balance never actually goes down. If that's you, you might be thinking you don't have to worry about how much interest is accumulating because it'll be forgiven anyway, but it's not quite that simple. Your debt will be considered earned income the year it's forgiven and then taxed. So in 2017, a veteran from Michigan had his loans erased and received a tax bill for $62,000 from the IRS, along with another $9,000 in state taxes. Talk about adding insult to injury, right? So I call this fake forgiveness because the government is really just transferring a big portion of your debt from the Department of Education to the IRS because the IRS has way more authority to collect. It impacts your credit score when you don't pay your student loans, but it's a federal crime not to pay your taxes. The IRS can even garnish Social Security wages in retirement or any tax refunds you might be eligible for, and I don't want that to happen to any of you. Unfortunately, again, most people on these plans have no clue to expect the huge tax bill or that it can be completely avoided with public service loan forgiveness. So if we compare the IDR forgiveness on the left now with PSLF, public service loan forgiveness on the right, in green, you'll see that with PSLF, you get to keep your low monthly payment on an income-driven plan, but you get your debt erased 15 years faster, so it's 10 instead of 25 years, and 100% tax-free. That's real forgiveness. So let's talk a bit more about the income-driven plans and the benefits of the new SAVE plan, and then we'll connect the dots, and I'll show you how to qualify for PSLF. So these are the 4 income-driven plans available right now. Going from the bottom up, you'll see ICR, income contingent repayment, IBR, income-based repayment, PAYE, pay as you earn, and then there was a plan called REPAYE, revised pay as you earn, but that was replaced by the new SAVE plan. So all of these plans have you make up to 25 years of payments, remaining debt will be forgiven, but taxed as income. One of the best benefits of these plans is that your payment could even be 0 and you'd stay in good standing without needing to go into deferral, forbearance, default, or collections. Now, I've underlined in green, you can see from this chart that the pay as you earn and SAVE plans offer the lowest payment at just 10% of your discretionary income. There's actually an added benefit in the SAVE plan. If you have undergraduate debt, it's only 5%, which is really a big deal. All borrowers were enrolled in who were in the repay plan are automatically being transferred to the SAVE plan. So there's no action that you need to take if you were enrolled in repay, and you'll just select the SAVE plan going forward. Now, according to this press release, I talked a bit on this just a few minutes ago, but quote, the Department of Education finalized the most affordable repayment plan ever created, ensuring that borrowers will be able to take advantage of this plan by summer, before student loan payments are due. Many borrowers will not have to make monthly payments under this plan. Those that do, so if your payment is anything more than 0, you will save $1,000 a year, which is really amazing. So here are the 3 biggest benefits of the SAVE plan, just to summarize. First, the SAVE program will significantly lower your monthly payment, potentially even dropping it to zero. In fact, more than half of the people who have already enrolled in SAVE have a $0 payment, and nearly 70% of people enrolled in SAVE have a payment under $100 a month. Second, there will be zero unpaid interest accumulation. This is giant. Let me go back here. This is a really huge benefit that no other plan has ever offered. That means your debt will not grow while you're enrolled in this plan ever, even if your monthly payment is less than the interest. And I'm going to explain more about that. And then third, if you're married but file a separate tax return from your spouse, you can use only your income and exclude your spouse's income from the calculation of your income-driven repayment plan. So those are big benefits. Let's go through each one of them here. So first is the lower monthly payment. The first big benefit of SAVE is that it offers the lowest monthly payment of any of the plans. The other income-driven plans used a formula where they would take your AGI, or adjusted gross income, and then subtract 150% of federal poverty guidelines based on your family size to get your monthly payment. The SAVE plan, it's the same calculation, but they actually take off 225% of federal poverty guidelines from your income. So it looks like you have a lower income, which means you have a lower payment at the end. And just to give you the real numbers here, if you're a single borrower earning $32,800 per year or less, or a family of four earning $67,500 per year or less, your monthly payment will be zero. Okay, so that's just a baseline number. After that, if you have undergraduate loans, your payment will be capped at 5% of what they call your discretionary income. And if you have graduate student loans, it's capped at 10% above that number. So borrowers earning more than these amounts will save at least $1,000 per year on the SAVE plan compared to the other income-driven repayment plans, which is awesome. Next is the zero unpaid interest accumulation. It comes with 100% unpaid interest forgiveness on all of your federal student loans after the first scheduled payment is made on the SAVE plan. That's really huge. So let's kind of go over some numbers on that. So in this example, the person has $800 a month of interest accruing on their loans, and their payment is $300. So normally the difference, your debt would grow by $500 a month. But with the SAVE plan, your payment drops significantly. So you have a lower monthly payment, and your debt will never grow because you get that $500 a month that normally would be added to your debt as interest. That gets forgiven as you go. So saving $500 a month over 25 years that's $150,000 difference. That means your debt will be $150,000 lower using this scenario on the SAVE plan than it would be on the other plans, meaning you would get a lower tax bill, right? So that's a major overview. We're not going to go too much into the details of excluding spouse's income, and that's kind of a complicated formula and part of the process. But I go through that with each one of my clients if that applies to you, and we can always go into more detail on that on a one-on-one call if you have questions. So the SAVE plan alone is a really great idea for most borrowers. It means that, but it also means that more people will have a payment that's less than interest. And that means even though your debt, it won't grow, it also won't go down either. And forgiven debt still gets taxed as income with the SAVE plan. So those who enroll in the SAVE plan and just meet one other requirement qualify for public service loan forgiveness, and they'll get the best of both worlds because they'll have the lowest possible monthly payment and get their debt erased in less than half the time, tax-free. This is a game changer. So my goal for the rest of this presentation is to show you how to break the chains of student debt slavery and meet the 3 requirements to qualify for public service loan forgiveness. Now, there are only 3 requirements to qualify for PSLF. I'm going to show you how to meet each of these in order as fast as possible and save a ton of money on your student loans. So the first thing is to make sure you have qualifying loans. There are actually 4 different types of federal student loans out there. They're called Stafford, Perkins, FFEL, and direct loans. Direct loans are over 80% of the $1.6 trillion of student loan debt out there right now. So most of you already meet that requirement. And also it's only been direct loans that have been issued for the last 9-10 years or so. So if you graduated, within that time frame, chances are you only have direct loans. If you graduated before then, you may have a mixture of direct loans with other types, or you may have just the other types of loans. So the cool thing is you can see here on the Fed Loan Servicing website at the bottom, it says there's a free process called direct consolidation. You can actually consolidate non-eligible federal student loans into a direct consolidation loan to make them eligible for both the SAVE plan and public service loan forgiveness. It's only direct loans that qualify for the SAVE program as well. And above that, you can see there's different types of direct loans: direct subsidized, unsubsidized, direct plus, and direct consolidation loans. As long as direct is the first word in your student loan type, it is eligible for public service loan forgiveness and the SAVE program. But most people have no idea what type of student loans they have. I had no idea what type of loans I had when I graduated. So you can access your student loan data by logging into studentaid.gov. When you download your student loan data, it'll be a long, confusing document, but near the top, you'll see lines that look like this. So this is a snapshot of actual student loan data from someone I've helped to qualify for public service loan forgiveness, who is in exactly the same financial black hole that we've talked about earlier. This person graduated in 2008. They bounced around between deferral and forbearance for a while before winding up on an income-driven repayment plan. And you can see with these red arrows that the person had $97,523 of principal debt and another $58,814 of interest. That's crazy, right? Their interest is now more than half of their principal debt. They went from having just under $100,000 of debt to now having over $150,000 of debt. So you can see here with these new red arrows on the left that this person originally had FFEL and Perkins loans, right? But if you follow those lines all the way to the right, those now are zeroed out. And that's because the top two lines show that they did a consolidation, a direct consolidation. So it turned their FFEL loans into direct loans. So now they're eligible for the SAVE plan and PSLF. So that brings us to step two. Number one, you need to make sure you have direct loans. Number two, you have to be in a qualifying repayment plan. So those are the income-driven plans that we talked about earlier. These are the 4 income-driven plans. For almost everybody, I'm recommending the SAVE plan. And it's very simple. Also on studentaid.gov, you can go on and it's about a 10-minute free online application where you can change the type of repayment plan that you're in. And then the last requirement is qualifying employment. So this one is kind of funny because only government and nonprofit employees are eligible. So when I first read this last requirement, my heart kind of sank, right? I didn't work for the government or a nonprofit, which meant I didn't have qualifying employment, and I didn't think there was any way that I would be eligible for PSLF. So let me share with you real quick about how I was able to make that happen. This is me in 2013 with a little girl named Caroline. You know how some people cross your path and they change your whole direction in life. It could be a teacher or a mentor or a business partner. My whole life changed when I met this amazing 4-year-old little girl. I remember like it was yesterday. It was October of 2013. My new patient had just arrived. She was pregnant and she was under a crazy amount of stress. She brought her daughter with her to the appointment, and we can all tell right away, this little girl had a serious health issue. She was as bald as I am, right? And so the first thing her mom said to me when we sat down for the consultation was, my 4-year-old daughter has stage 4 cancer. I still get chills when I talk about this, you guys. Can you even imagine? No parent or child should ever have to go through something like this. I've had a lot of emotional experiences in practice so far, but this one really got to me. I had a 2-week-old baby boy at the time, and I did everything I could to look strong during this appointment, but I broke down as soon as they left. I just couldn't imagine the physical, chemical, emotional, financial stress that this little girl and her family were going through. And I wanted to help as much as I could. It's why I became a healthcare provider. So I came home that night. I kissed my perfect sleeping newborn son on the head. I was so grateful he was healthy. And I decided that night, I wasn't going to let finances get in the way of this family getting the care that they needed. It wasn't something new. I had provided discounted and sometimes pro bono care for people with special circumstances in the past, but Caroline really sparked something powerful within me personally. And let me just say, most people don't come back from a stage 4 cancer diagnosis, right? But I am so proud to say that Caroline did it. This is her with her little sister. As of December of 2023, Caroline is now 9 years cancer-free, which is unbelievable. All her hair is back. She's back in school, back in dance. And so fueled by that amazing experience with this brave and beautiful little girl and her family, I actually decided to give back to my community on a bigger scale and start a nonprofit arm of my practice with a mission of expanding access to care for even more deserving people. And so it was, here's the secret sauce, you guys. It was about a year after starting the nonprofit that I had this eureka moment. It literally felt like I was struck by lightning, because I realized you don't have to quit your job or work for the government or a nonprofit to qualify for PSLF. I had reverse engineered that requirement by starting my own nonprofit, right? And so the answer was right in front of me the whole time. It's actually pretty simple. And so you can start your own nonprofit to give back to the community. And I actually had a client who told me, this is the best win-win of all time. You get to make the world a better place and get your student loans erased. So how cool is that? That is the purpose of the student loan eraser. So we've now started over 500 nonprofits all across the US. Clients are going to save over $150 million on their student loans, which is absolutely ridiculous. But the best part is that they're making a huge impact in their communities while they work towards loan forgiveness. So a lot of people, I mean, I didn't at the time, a lot of people really don't know what a nonprofit is or how it works. So take a quick second to explain that. A nonprofit is a charity. Any nonprofit or charity with 501c3 status from the IRS, it's a form of business that provides a qualified public service. Anything in healthcare can qualify. They're exempt from paying taxes at the corporate level, and people who donate to these organizations can take a tax write-off. So about 75% of hospitals in the US are actually nonprofits with 501c3 status. And that means when an MD graduates with $300,000, $400,000, $500,000 of student loan debt or more, and they go to work at one of these hospitals, as long as they have direct loans on an income-driven repayment plan, their debt will be erased tax-free with PSLF. Crazy, right? They have built-in qualified employment. But these nonprofit hospitals, they still charge a fee for service. They bill insurance like any for-profit hospital, and they use the income those fees generate to pay the hospital's expenses, including everyone's salary. The mission of these hospitals is to provide access to quality medical care for their communities. That's the exact same model we're using, just on a smaller scale. So let's come back to the title of this presentation, right? I promised to show you how to turn supplement sales into student loan forgiveness. So once you have direct loans on an income-driven repayment plan, you meet the first two requirements for SAVE. And the last requirement is qualifying employment. The mission of your nonprofit will be to expand access to healthcare for your community. Part or all of that mission could be through supplement sales. So the nonprofit would have its own account with a virtual dispensary like Fullscript and sell supplements, and then use those funds to pay its own business expenses, including the doctor's or including your salary, right? As soon as you're on payroll in the nonprofit, now you have qualifying employment and you meet that third requirement for public service loan forgiveness, and your countdown to tax-free forgiveness has begun. I'm assuming many of you are already selling supplements. That's often not the only source of income for your business, and it also doesn't need to be the only source of income for the nonprofit either. You can offer other services at a discount for those who qualify. So let me show you how that works. Have you ever taken a new patient through your initial process and made recommendations only to hear the four dreaded words, "I can't afford it," right? It's not a bad thing. It happens to all of us. And I know that some people use that as an excuse, right? But there are people who are living paycheck to paycheck, right? So what do you do in that situation? Do you turn them away? Do you charge less? Do you sometimes provide your service for people at a discount? Is there anybody right now in your practice who's not paying your full fee because they had special circumstances and you just wanted to help them out? Maybe you give a discount for people with a financial hardship, or for active military or veterans or people without insurance or kids or any other special group, right? Well, if you've ever discounted your services for someone in need, you are providing a public service, which means you're expanding access to healthcare, right? That also means you're already doing the majority of what it takes to qualify for public service loan forgiveness. Expanding access to your services through a nonprofit by providing a discount for people in need allows you to qualify for PSLF, which is a huge win-win, right? Again, you get to make the world a better place and get your student loans erased. So here's how it works. Once your nonprofit is set up, when someone pays the discounted fee or purchases supplements, those funds will go straight into the nonprofit bank account. That money will then be used to pay you a small salary. The paycheck doesn't need to be much. You can even start at minimum wage, which in most states is still $7.25 an hour. A lot of people ask me how the nonprofit will raise enough money to have you on payroll. So let me show you exactly how easy this is, and we'll go through some numbers. So if you're one of those states where it's minimum wage is $7.25 an hour, the total overhead for your nonprofit, including payroll, will be under $1,000 a month. So let's just use that as an example. Now, let's say you normally charge $70 for an office visit, right? That could be for a chiropractic adjustment, for an acupuncture session, for a nutritional consultation, for a service as a naturopathic doctor, whatever the normal service is that you provide. When someone has a financial hardship or they meet one of your other requirements to qualify as a nonprofit patient, they receive the same service, and let's say it's 50 instead of 70, right? That means you only need to see 20 nonprofit patients per month, or an average of 5 a week, and your organization will be self-sufficient financially, and you don't have to go do any fundraising or anything like that. Now, if we add supplement sales into that, let's run example number 2, right? And let's say you're able to raise $500 a month from supplement sales. Now you only need to see 10 nonprofit patient visits a month at $50 per visit. And you've hit that break-even point. The other cool thing is if you have friends, family, patients, or other people who might be willing to donate to your nonprofit to support your mission and help your organization, they can claim a deduction on their taxes. So, and you can even make tax-deductible donations to your own nonprofit, which is amazing. The IRS actually has a rule that says nonprofit founders can donate up to 2/3 of the annual revenue to keep the organization going. So between supplement sales and services and also donations, you can see how easy it will be to make this whole process work for you, right? And to reach that break-even point. Okay, so I love this GIF. Let me go back. This is one of my, come on, there we go. This is one of my favorite GIFs of all time. I hope you just had an aha moment right now, like the light bulb went off for you. But by starting a nonprofit, you'll put yourself in a position to help more people, make the world a better place, qualify for PSLF, and get your student loans erased. That's the whole goal. So here's a quick summary, you guys. This is an important slide. This is how to qualify for total, complete, unlimited student loan forgiveness in 3 simple steps. Step 1 is to make sure you have qualifying loans. If you don't have direct loans, consider a free process called direct consolidation. Step 2 is to make sure you're enrolled in a qualifying income-driven repayment plan. You can switch repayment plans for free with the IDR, income-driven repayment application online. And then the third step is to make sure you have qualifying employment. You can start a nonprofit to expand access to healthcare for people in need, which is really, really amazing. So I'm going to take just a few minutes now to talk about what's included in the student loan eraser. The shortest distance between 2 points is a straight line, you guys. I did not take a straight line to qualify for PSLF. There was nobody guiding me through this process. I had to figure it all out the hardest way possible, which is my own research and trial and error. It took me a lot of time and energy and money, but it was worth it. And the best part here is you don't have to become a student loan expert like I did. After I was able to qualify for PSLF, I had a few colleagues who asked me for help through the process. and the student loan eraser program was born. So let's go through what's included in the student loan eraser, and then we'll jump into the Q&A. So the student loan eraser is a practically done for you system designed to guide you through the process of starting a nonprofit and meeting the 3 requirements to qualify for PSLF. It takes an average of about 90 days. The program includes full access to the Student Loan Eraser membership site. That's why I broke the process down into 8 super easy to follow, bite-sized video training modules that will walk you through each and every step in the process. So module 1 is the custom student loan plan. That's where I will personally review what type of student loan debt you have, what repayment plan you're in, and I will make sure to give you the exact information you need on if you need to consolidate, if you can, if you should change to the save plan. So by the end of that first step, we will know that you have direct loans and that you're in the best income driven repayment plan with the lowest possible monthly payment to maximize your savings and cash flow while we go through the rest of the process. Module 2 is a phone call. You and I will jump on the phone and I'll help you design the nonprofit. We'll talk about things like the mission statement and the board of directors. Who do you want to serve in the nonprofit? We customize each of these nonprofits to you and the communities and groups that you want to serve. And so from there, all that information gets sent to my team. We do all the legal work for you. The program includes all the legal state and IRS fees. So we will write the articles of incorporation and bylaws, send that to the state. We'll get the tax ID. We'll get 501c3 status for your organization. All of that happens for you. While that paperwork is in process, most people say it only takes about an hour a week. So module 3 is your first board meeting. That should take about 30 minutes. I show you exactly how to do it. Module 4 is to just open a bank account for your organization. Module 5 is really exciting because that's when you will connect a payment processor, a POS, to the nonprofit bank account so you can start to bill nonprofit patients and collect revenue to the organization. That's also when you will start payroll. And as soon as you're on payroll, the first month you're on payroll is also the first month that will count towards public service loan forgiveness because now you meet those 3 requirements, right? Now you have qualifying employment. There's actually no action steps in module 6 or 7. We're just waiting on 501c3 status letter to come back from the IRS at that point. So module 6 covers office systems, things like patient communication, how to explain about the nonprofit to your community, how to identify potential nonprofit patients, what to say about the nonprofit when someone says, I can't afford it. I have I call it the I can't afford care conversation template. In my practice, when someone said, I know I need this, I really want care, but I just can't afford it. I would let them know, I totally understand, right? And it's really important for me to be able to provide care for people regardless of their financial situation. So I actually started a nonprofit to expand access to care for people in the community. Here's an application form. If you qualify, all my recommendations stay the same. You still have care with me right here in this office, but you'll be eligible for, as an example, $50 office visits instead of $70. And I kept tissues in my office because people would literally cry and thank me for being a healthcare provider that cares more about helping people than what's in their wallet, right? And, as far as how you price your services in the nonprofit, it doesn't have to be, there's no specific rule. Most of my clients offer a lower fee, somewhere between 25 and 50% lower in the nonprofit than in their for-profit, right? If your fees are already on the higher end, you may want to consider a bigger discount. If your normal fees are already on the lower end, you may want to consider a smaller discount. That's kind of how that works. So that's module 6, office systems. Module 7 is annual compliance. Nonprofits don't pay taxes at the corporate level, but they still have to file a very simple return. I'll show you how to do that in module 7. We even have options where my team can even help you with that and do the tax returns for you every year. And then module 8 is the last step. As soon as you have your first paycheck from the nonprofit and 501c3 status from the IRS, module 8 will walk you through the PSLF paperwork. You'll submit that and get a letter back that lets you know that you have at least 1 month by that time that counts towards public service loan forgiveness. So you're in. You don't have to wait 10 years to find out if the process worked. A lot of people ask me, how much can I save? I've looked back, and over the last several years that I've been running the student loan eraser program, our average client is able to save $267,432, which is absolutely insane. Obviously, if you're not a doctor, your savings might be less than that. I've had people save over $800,000 before because they had multiple degrees and compound, they let their student loans go on forbearance. And when you come out of forbearance, interest capitalizes. So their debt just, blew up out of control. I showed one of these earlier in the presentation. Here's another one. This is a client, Luis, who sent me his final paperwork from the Fed Loan Servicing, the Department of Education, saying that he had $113,261.51 of debt erased with the Public Service Loan Forgiveness Program. So I want this for all of you guys. The program even comes with a 100% money back guarantee. By the time you submit that letter to the Department of Education saying that you meet the requirements, the employment certification form, you will get that letter back saying that you're in. We've never had anyone denied. If you're denied, we'll fix it. If it can't be fixed, you get a full refund and you get to keep the nonprofit if you want it. That's the guarantee. So a lot of people ask me, I'm a really big believer that the opportunity of a lifetime must be seized within the lifetime of the opportunity. I've been teaching this process now since 2016, and I can honestly say there has never been a better time to qualify for PSLF. So if you've been on the fence about this for a while, if you've heard about it, if you've considered this in the past, I would encourage you to take action now. In the White House press release on June 30th, it was made clear that a major goal of the Biden administration is providing debt relief for as many borrowers as possible, as fast as possible. So I want you to catch this train, right? The Biden administration has already approved cancellation of more than $144 billion in federal student loans, wiping out debts for nearly 4 million borrowers. And I don't want you to miss this opportunity of a lifetime. So right now, that's it for today, you guys. I am intentionally not going into pricing for the student loan eraser. Like I said, I'm not trying to sell that on this web class. That's not what today was about. This is to update you on major events in the world of student loans and on options for student loan forgiveness so that you can be informed and make the best possible financial choices. I'm sure you have questions about the SAVE plan, PSLF, the student loan eraser program. So right now, go check out www.erasemystudentloans.com/Fullscript. You'll be able to schedule a free student loan consultation with me, watch the replay of this web class as soon as it's available, and get a free Fullscript account. And in the meantime, if you have some questions, let's jump right into the Q&A.
Perfect. Thank you so much, Dr. Hoffman. We have quite a few questions, so we'll get started now. Awesome. The first one is, if I've been paying on an IDR plan for over 10 years, when switching to a PSLF plan, does the time start over towards the 10 years of repayment?
Got it. It doesn't start over on the IDR plan. So the same 10 years that counts towards public service loan forgiveness will continue for the IDR plan that you're on. So if you've had 10 years on your IDR plan, that means you likely have 15 years left. And the same 10 years that counts for PSLF also counts for the IDR plan. So what I mean by that is your debt will be erased 5 years faster with PSLF because that time, that 10 years, starts from the moment you meet the 3 requirements. You don't meet the 3 requirements until you have qualifying employment, even if you've already been on an income-driven repayment plan. So that's when the 10 years would start. So we'll be able to cut 5 years off your repayment timeline and get the debt erased tax-free. Also, the nice thing is the PSLF program isn't going anywhere, but already having been on an income-driven repayment plan, that's your backup plan. So let's say you're 8 years into the PSLF program. You've already have 10 years with the IBR plan. So at that point, let's say for whatever reason you decide, hey, I'm going to move to another country. I'm not going to continue with my nonprofit. You shut it down, right? You now have, instead of just the 10 years on the IDR plan, the same 8 years that counted for PSLF continues with your IDR. So now you have 18 years on your IDR plan. You only have 7 years left. So you're no worse off than when you started if you decide that you want to shut down the nonprofit or life circumstances change or anything. I don't think I've really had anyone do that, but it's there as a kind of a built-in backup plan. I hope that makes sense.
Perfect. Thank you. The next question is, if I already have a Fullscript account, do I need a separate account for my nonprofit?
You should, yes, because your current Fullscript account is attached to your for-profit, and that means that the income from those sales goes to your for-profit. And we need the income from supplement sales to be attached to and go directly into the nonprofit bank account.
Perfect. The next question is, if this is a nonprofit, if this is a non-for-profit and government related, do we have to take insurance to see patients?
You don't. And in fact, that's a great question. Most of my clients, they actually keep their nonprofit a really small, easy to manage cash practice. For the most part, if you bill insurance and someone has insurance, you're not really expanding access to care by billing that insurance in the nonprofit. What I do have people do is they will make their nonprofit kind of a wellness plan. So if someone has insurance and they use it and that insurance runs out and then they can't afford to continue care as a cash patient at the full price in the for-profit, then they will be transitioned to the nonprofit as financial hardship or no insurance or something like that. And that's something that's really my clients do quite a bit.
Great. The next question is, what if your organization is 100% virtual and you have docs in several states? Can a nonprofit be created, and can student eraser help?
Yes.
Easy. So the next question is, can this process be reversed? I just started a nonprofit and have a Fullscript account as a nutritionist and functional medicine herbalist and health coach. I'd love to get more education / a medical license or become an acupuncturist. Would this process work to pay for schooling?
No, they don't give you $200,000 because you work for a nonprofit. You have to already have the $200,000 of debt, and you get that debt erased because you work in public service. But there is a chance that, let's say you go back to school now, you take out your student loans, as long as the public service loan forgiveness program is still going, then when you graduate and you have those loans, you can start the process then to get those loans erased.
Perfect. The next question is, do we need to work 30 hours per week for nonprofit to qualify?
Yeah, that's a great question. So the way that the public service loan forgiveness program defines qualifying employment is 30 hours a week. So 30 hours a week at minimum wage. If minimum wage is $7.25 an hour, not all states are, but most are. That comes out to $870 a month, which is why I rounded up and said $1,000 a month would be the overhead. But the cool thing is the Department of Education, and also, by the way, in module 7 of 8 on the membership site, I go into all the details about how to get the hours, how to track everything. You don't have to clock in and out. You don't have to do any of that. It's an average of 30 hours. So if sometimes you work less, other times you work more, no big deal. And what a lot of people do is they'll actually, let me give an example. When I was first in practice and I hired someone for my front desk, early on in practice, things were still kind of slow. I might have had a gap of 20 or 30 minutes between patients. My front desk staff still got paid for that time because they were there and they were available. The same is true here. So a lot of my clients, what they'll do is they'll set the same hours in the nonprofit as they have in the for-profit. So as long as you're there and you're available to see nonprofit patients, that time is going to count, right? I teach all sorts of marketing. If you're out in your community, if you're giving health talks, if you're giving, doing screenings, if you're doing any sort of marketing, I say ask for a suggested donation of something small like $5. Now it's a fundraising event, and that time counts for the public service loan forgiveness program. So I have all sorts of ways to make it really easy, because I know that adding 30 hours a week to your already busy schedule for people who have families and work, it's just not doable. So it is doable, and I show you exactly how. I have over 600 clients who are doing it and doing it successfully.
Wonderful, thank you. The next question is, what if we started a practice, let's say 8 years ago, and have not been highly profitable? Could we backtrack the nonprofit timeframe?
I love that question. No, unfortunately. Not being profitable is not the same as being a nonprofit, right? So you actually have to have your business registered as a nonprofit organization, which is a charity. Not making money is not the same as being a charity, right? But what you can do, a lot of my clients ask me this. They say, hey, I'm just graduated. I don't even have a for-profit business, or I don't, or my business is new or very small. Do I have to run a for-profit and a nonprofit to make this work? The answer is no. I have clients who run their entire practice as a nonprofit. So in your situation, I might suggest that we start the nonprofit, you transfer all of your current patients into that, and then you could eventually close your sole proprietorship, LLC, corporation, and just run your practice as is, as a nonprofit, and we can make that work. Perfect.
The next question is, can I start a nonprofit and have my daughter with student loan debt work for the nonprofit?
Yes. Your daughter, and thank you for touching on this. This is something that a lot of my clients are starting to use this as an employee attraction and an employee retention strategy. So imagine that not just your daughter, but for any of you who have associates or contractors or other employees that work for you, if you hire them in the nonprofit as well, you can provide them with a path towards them getting their student loans erased. And it's a great way to attract new employees. And also they would want to work for you for 10 years to receive student loan forgiveness. So that's a huge win-win situation. And in fact, the student loan eraser program, it actually comes with support for the first 2 nonprofit employees, yourself plus 1 additional employee that you want to onboard. And then anyone else after that, there's a small fee. We don't have extra legal, state, and IRS fees to just hire new employees. So I pass all that savings on to you. So far, the biggest team that I've worked with has been a group of 14. We started 1 nonprofit, and it took about a year to onboard the whole team, but we were able to make it work.
That's awesome. The next question is, can students begin a nonprofit while in school? What is the best thing students can do during school to start paying if possible?
Yeah, so this is a really tricky question, right? If you're not going to work towards public service loan forgiveness, then I think the best strategy as a student is to borrow as little as you possibly need and also pay the interest as you go, because otherwise interest is growing as a student, and then they give you a 6-month forbearance automatically after you graduate. And as soon as that 6-month forbearance is done, all of the interest that accrued up to that point capitalizes, which means it's added to your principal debt. And from that point forward, you're paying interest on your interest. It's a crazy system. So one strategy might be to pay the interest as you go. Unfortunately, you cannot qualify for PSLF until after you graduate. Because you have to be on an income-driven repayment plan as one of the 3 requirements. And you're automatically in an in-school deferral as a student. You can't be on an income-driven repayment plan until after you graduate. So what a lot of people do, it depends on how close you are to graduation. What I do have as an example is, let's say you're in your last 6 months. we can get all of our ducks lined up in a row, get the nonprofit formed, and really do all of the steps except the income-driven repayment plan, and then circle back and get you on the income-driven plan and get you on payroll as soon as you graduate, so that day one you qualify. I even have extended payment plan options for students because I remember the kind of budget I lived on as a student. So I want to be able to help. So reach out to me is the easiest way to do this. If anyone wants to send me an email, it's info@erasemystudentloans.com. But the easiest way is to let's schedule a phone call. Jump onto erasemystudentloans.com/Fullscript, schedule a call with me. I did a webinar for you guys for Fullscript a few years ago. And within 24 hours of that webinar, I had over 100 people schedule a free consultation. So I'm really here for you guys. I want to give my time, get all your questions answered. I opened 100 spots on my calendar again, and I'll open more if necessary. But I hope you guys take advantage of that.
That's awesome. Thank you, Dr. Hoffman. The next question is, does the 10-year period begin from the loan date or the loan repayment begin date?
So it's a really great question. There are 3 requirements. Let me go back up here. These are the 3 requirements for PSLF. You need to have qualifying loans, you need to be on an income-driven repayment plan, and then you need qualifying employment. The 10 years starts as soon as you meet the 3 requirements. So as soon as you have direct loans on an income-driven repayment plan, those are usually the first 2 requirements. A lot of people already meet those first 2 requirements. If you're already enrolled in the SAVE plan, or you were enrolled in the revised pay-as-you-earn plan, it's only direct loans that allows you to be on those plans anyway. So if you're already in one of those plans, you already meet the first 2 requirements. The last requirement is qualifying employment. So as soon as you receive your first paycheck from the nonprofit, that signals that you have qualifying employment. That's when the 10-year time clock begins.
Great. The next question is, how do we learn about the rules of how and what are qualifying expenses for a nonprofit?
Great question. So Module 3 and Module 7 cover compliance. So in Module 3, we go over things like nonprofit do's and don'ts, red flags, things to avoid. One of those things is avoiding private benefit. The nonprofit can pay you a salary, but nonprofits don't have shareholders. They don't have, you can't take a owner draw or a shareholder distribution from the company. So there really is the only kind of guideline as far as how nonprofit funds need to be spent is that it needs to be a legitimate, justified business expense, just like you have the same rules for a for-profit. The nonprofit needs to be able to, it can hire employees. It could pay rent. It could pay, there's lots of things. So one of the things that you'll see that you get in the Student Loan Eraser program is unlimited support provided by me personally. So as we go through the process, if you have questions regarding, the nonprofit taxes or expenses or how do I do this or that, most of that is already covered in the modules. Anything above that, you send me an email, we jump on a call. I'm here to guide you through step by step and get your answers, your questions answered.
Perfect. And I think we probably have time for one more question. So this next one is, if we have previous debt, but we'll be going back to school this fall, could you start paying the old debt and then add the new debt upon graduation?
Yeah. So as long as you don't put that previous debt into an in-school deferment, right? So as long as you are able to stay on an income-driven repayment plan for your old debt, and you're working for your nonprofit while you're a student, I have had people do that. So I can walk you through that process, and the answer is yes, it's doable. So you would have 2 different dates of forgiveness. One date would be 10 years from the time you start with the loans you have, And then the second date would be 10 years from the time you start with, the new debt after you graduate from this next program.
Perfect. Well, we are about to be wrapping up, so I just wanted to thank Dr. Hoffman for being here today and everyone for joining us. We will be sharing a copy of the recording from today's presentation, so keep an eye on your inboxes and have a wonderful rest of your day.
Awesome. Thanks so much.